Hello, I'm Dr. Richard Gangwish. Today we're going to be restoring dental implants. Implants are a fantastic way to replace missing teeth. The bridge that we're going to place will be cemented permanently to the implant, so it'll be almost like having your natural teeth. No plastic in the roof of the mouth, no unsightly clasps. In this video, the patient had implants placed 6 months ago. Now that the area is healed, let's get started. What we're doing now is we're taking the healing caps off the implants. Now what the healing cap is for is to get the gums into good shape, allow it to heal around there. That gives a nice contour to the gums. It also protects the implant too. Now we have a little thing called impression coping. What that'll be used for is we'll be making a mold of these areas along with the remaining teeth, and that's what we're going to send to the lab, and they're going to make a beautiful set of teeth for her. It's important that everything's precisely in place, because that if you can't give the lab a good model to start with, they're not going to be able to make a good finished product. Now this is an impression tray. Notice it's got some thin plastic there at the end. I've poked a couple of holes in there. That's going to allow me to get those impression copings out. We'll have to go through that plastic and unscrew those. So we'll go ahead and make a mold of the of all this. That'll just take a few minutes to set. And that's the finished mold there. It will send to the lab. And back with the healing collars, make sure that everything's well in place there. I'll keep those gums in good healthy state. Keep food from packing into the implants. And that's called a flipper partial that the patient's wearing in the interim. You better believe she'll be quite happy when she gets the permanent placed. Alright, the big day has come. Now we're taking off the healing caps again. That's what the implants look like up inside the gums. Healed up quite well. These are custom abutments. What those are is little posts that we're putting in that will end up holding the bridge in place. This is what's going to be attached. We're screwing those right into the implant. It's very important we get these precisely placed. There is no margin for error on this type of work here. Check for the fit, make sure that's fully down. And we'll go ahead and hand tighten that into place. You notice we've got the floss on that wrench there. We'd prefer if we have to retrieve it, it's better than having it go down someone's throat. Those get a little slippery sometimes. Alright, now we're going to go ahead and try the bridge in, make sure that fits good. Looks like it slipped in pretty easily there. A lot of work ahead of time's done to make sure that that goes well. Check with some floss, make sure the contacts between the teeth are in good shape. Don't want to give the patient an excuse not to floss. And the bite is extremely important. We have to make sure she's not hitting too heavy on that. Looks pretty good here. So Now we've got to decide, is this looking good? Which, as far as I'm concerned, that looks fantastic. Now it's up to the patient to make that final decision, though. Now this is called a torque wrench. Now what we do, we have to put an exact amount of torque on those screws so that they won't loosen during function. It's very important we get this very precise. We've been doing these for many decades at this point, so I've got it down to a pretty good science, so we usually don't have too much problems with maintenance on these. Doesn't bother the patient. This patient isn't even flinching at all because that's being torqued into the implant itself, which has no nerves in it. Now we're going to go ahead and add some material inside those screw holes, because even though we rarely have to go in them, if we do, we want to make sure there's not going to be a bunch of cement that's going to clog that up and make it impossible to get to. So we'll put some material in there to plug up those holes. Now it's time to permanently cement that in place. Things come along real good at this point. So here's the cement. This is what it looks like. Go ahead and mix that up, and then we'll go ahead and place that in the bridge. And we'll seat the bridge fully into place. Always checking, gotta make sure everything's fitting perfectly before we wait for that cement to set. It's looking pretty good, so we'll clean that up, and we've got a happy camper there. She loved them. Not only does our patient now have a beautiful smile, but she can also function with them just like her original teeth. We expect her to have many years of smiles from these implants. Thank you for watching. I'm Dr. Richard Ganglish.